Okay.
So it will be live?
Yes.
Oh, okay. Yeah. Okay. Let me get that hooked up right now.
Hello viewers, I'm Ron Grant coming to you live and direct from Tortola in the Virgin Islands. Today we have a very special report. Joining us today is the Honorable Minister for Health and Social Development, the Honorable CARVIN Malone himself. He is here to provide an update on a number of matters concerning the Ministry of Health. Of course, we have seen some updated statistics. We know that there are vaccine drives. There have been a number of shifts as well within the Health Ministry. We're going to talk all about that. We'll be right back after a word from our sponsors. You're watching 284 News.
Live stream cable TV is here with CCT Live. Access over 80 channels that you can watch either at home or when you're on the go. And don't worry about missing your favorite series, sports, news, and local programming. Rewind and watch in your own time. Come to CCT today and ask about our 1-month free trial offer. CCT Live. Bring it home.
Viewers, welcome back and thank you so much for sticking with us. As promised, I am today joined by the Honorable Minister for Health and Social Development, the Honorable CARVIN Malone. He is also an at-large representative. Honorable Malone, good morning and welcome to 284 News.
It is indeed a pleasure to be here in the 284 studio once again. This is the first time for 2022.
Indeed.
And I would like to say good morning and hello to all of the particular persons here in the Virgin Islands, in the region, and throughout the world.
Of course, we are in a new year, but that does not mean that we're not dealing with old issues such as the COVID-19 pandemic, which is continuing on. I want to begin on that note, Honorable Minister. We have received some updated statistics. Of course, we're thankful to see that cases are significantly declining in the territory. Unfortunately, however, we see where we're still having a number of deaths. Most recent statistics show that those are mostly our senior citizens. Speak to the present situation of COVID-19 in the British Virgin Islands.
Well, first of all, we've had over 24 months because it was first a particular variant of study back in November, December of 2019 when this virus showed itself in Wuhan, China. And our laboratory, and we have done all that we could to prepare us for what was to come. But little did we know the kind of effects that it would have on health, on the community, and on businesses. So we have conducted over 90 somewhat thousand tests in all labs. We have had a total of 5,839 positives in that, but the recoveries have been 5,393. So, and we have 49 deaths. and we'll speak more of that. So currently, we have positive cases of 397 within the territory, and this is a decrease from the 1,387 just 2-3 weeks ago. It is important to note, however, that the decrease since our last stat was 18. 18 because we had 30 new cases, 48 new recoveries. Now, what is important is that for us to get the new cases down to where it is single digits, because if you have 30 new cases, it means that we would have to contact trace all these persons. And who are our most vulnerable? We have the Pfizer vaccine that is now available to the children from 17 to 12, but we have our elderly, my senior gyms, I call them, who are the ones who seem, in this particular variant, to be more susceptible to the particular hospitalizations and the deaths. So we have to be mindful that we have to protect our most vulnerable, our senior gyms, our children, because when I check the hospitalization records, most of the persons are over 50. Most of the persons who die are over 50. Most of them are unvaccinated. So we have to do a specific areas. I'll speak more about the drive-through vaccination process that we have over this weekend so that you can be more informed.
All right, Minister Malone, before we get to the drive-through vaccination, I want to come back to something you just said in regards to most of the persons who are unfortunately seemingly passing away from COVID or complications of that are unvaccinated. Talk to me about these statistics as it pertains to persons who may have lost their life who were vaccinated.
Well, you have, because in the hospitalization records, it is shown that about 80% are unvaccinated. And you do have the occurrence of those who have been vaccinated because they, most of these folks are not without underlying conditions. So as I have mentioned before, I'm not sure if it was depicted properly, but I've said if COVID, especially this American variant, if it catches you leaning, it pushes you. It does not pull you back up on the table. It does not give you a chance, except that you have strong immune systems or you have, you've been assisted by the particular vaccine or other natural immunities that you may have. So it is important that we follow the science and we do what is most effective, what has been most proven in this particular fight against the COVID-19 and the various variants that you have. So a number of unvaccinated persons, those are the ones we have seen most that are being admitted to the particular ward. We have a case where there are those persons who are still skeptical. So when they have the symptoms, as opposed to coming and getting whatever treatments they have, they're trying to have it treated at home. This is not the way to do this. We have to make sure that you call it in, and then you would be directed whether to come in or you can take the preventative steps. It is actually critical that we do not take it to the workplaces, to the churches, to the particular, to actually compromise a friend, a senior gym, a particular child, 17 to 12.
Understood. So we're encouraging persons, once again, viewers, if you are experiencing symptoms, to call it in. Minister, over the past weekend, my phone was pretty much ringing off the hook from a number of persons within the health ministry. Of course, you would remember at that time I did reach out to you for an opportunity for us to have a conversation. Many persons saying that at that time the hospital morgues were down. And of course, different measures were being done to transport bodies and accommodate that. Speak to the situation as it pertains to the hospital morgue. Is it still down? What was the process in transporting bodies? Many were concerned that it was possible that COVID-related deaths were being mixed with regular deaths. Speak on the situation.
Well, we had a particular occurrence where, because during that period in June, July of 2021, when we had the spike, 30, 35, 36 deaths, we did have an occasion to purchase a field morgue, and we had put it into operation. Now, that compressor was in fact down, we had to take preventative steps in terms of making sure that we search the entire territory looking for a replacement compressor or a new particular facility. But we were able to find one. And when we look on Saturday, as fate will have it, because it is no secret here in the Virgin Islands, as fate will have it, the main morgue for a very short period was down. Was identified not to be fully operational.
Okay.
So all preventative steps were made because it was critical for us to make sure that we did not allow any of the souls that were in at the time to actually deteriorate. So we had to take emergency steps to make sure that they were placed in a place where it would not cause big disruption in terms of the souls of the persons dearly departed.
Can you identify what those steps were and how your ministry was able to handle that?
Well, the ministry was there's no secret that we had to make sure that we were able to get another field morgue and actually transport the bodies in a dignified manner, as opposed to what is being placed out there. But most critical for me, most critical for the HSA, most critical for the staff was to preserve those souls so that there will be no deterioration.
Thank you, Honorable Minister. I have to mention, of course, the UK in recent times. They have been really relaxing their protocols and essentially doing away with the mask, doing away with a lot of the protocols that we have become so very used to. Here in the Virgin Islands, residents are concerned and wondering what is the state of that. Of course, we are a UK territory and we're known to, in many cases, follow their footsteps. Will we be following the UK's footsteps? Are we expected to follow the UK's footsteps as it pertains to relaxing mask wearing and other protocols as it pertains to COVID-19?
Well, what we've done throughout this over 24 months of the COVID-19 is that we have taken our guidance from whether it's CDC, whether it's from CARVIN, whether it's from Public Health England, Public Health Canada, and all of the authorities that have been able to guide us through this particular pandemic. We have moved the particular quarantine period from 14 days down to 10 days, and now it's at 7 days if you test out with a rapid test. If you have 10 days, then you can test out, you can be released in terms of this, because as we go forward, as we move this particular forward, as we study more in terms of what attains, we are finding that there are some studies that will allow us to be released at 10 days. There are those places in the business place that says, well, before you come back, they would like to see that you would have at least a rapid test so that you will be certified as non-contagious as it relates to the virus and spreading it with the particular staff and the other personnel, because it is a protection of lives and livelihoods. And this is what we do. Now, we know that the UK is now looking to bring it down to 5 days. We have not gone that step as yet. We know that they're seeking to have the eradication of the mask. We don't see ourselves as being leaders, trend in these particular measures. We were not leaders when it comes to mandatory vaccination. We said we do not want to mandate it. So we did not follow that trend. We did not follow the trend when they were bringing it down to a number of other measures which we deemed not to be responsible for our case. We cannot say it was not responsible for their circumstances. But
Understood.
If their records were more impressive in terms of deaths, in terms of hospitalizations, in terms of the contraction of the thing, then contraction of the virus, then we could have said, well, okay, fine. Every step of the road, we don't have to analyze anything here. We can just follow suit.
Understood.
But we take it guardedly. So there's no immediate rush to actually say that masks are not important. They are. There's no immediate rush to say that 6 feet or 3 feet is not important. It is. There's no immediate rush to say that sanitization is not necessary. It is. And we would look at all of the steps necessary to protect all lives, all livelihoods, because our record must be recognized for the particular way in which we were able to open back our economy. The yachts are coming, the cruise ships are coming, hotels are filling up, car rentals are there. So we have to keep our economy running, and it's only by being prudent that we can do this.
Thank you, Honorable Minister. I have to go back. There has been some shifts in the actual roles in the Ministry of Health at the BVI Health Services Authority. Of course, more recent, we would have heard of the switching of roles with the Chief Medical Officer, also the Human Resources Manager. Of course, we have yet to have received anything official from your ministry stating the reason for the switch. Can you provide an update on the situation and the matter at hand where two of the key personnels, both Mrs. CARVIN Malone-Smith and Mr. Labor Letsam, were seemingly shift, or they're no longer in those positions? What is the update on that?
Well, they both were in acting roles. As you remember, Dr. Georges was our last substantive CEO. There is a global presentation being made. We have persons who have applied from throughout the world in terms of getting the Health Services Authority, in terms of the CEO substantive roles. We have persons from here in the BVI who have applied. There is no doubt, there's no secret that I have said from the very beginning, and it was delayed only by the coronavirus and the 24 months that we had to, put into this. But it is important that we note that there will be a full review of almost every major role in the particular HSA in the Dr. D. Orlando Smith Hospital, and we are going to seek to make sure that we have the greatest of efficiency. Our particular health services system is going to come under a 100-year celebration come 2022, this year. And we are making plans for this because, of course, Peebles Hospital was built back in 1922, so 2022 will be 100 years. We are looking at every role, every position, every spot to make sure that we have the greatest of efficiency in there. So there is a non-disciplinary administrative leave that the officers have been placed under. It will become more apparent as we go. But I would like to be public here in stating that these are the very persons that I have had to call on when in the height of the pandemic. These are the persons who have been critical to making sure that all of the areas were put in place, together with the entire staff, yes. But we must play we must give specific attention to the fact that there were a number of persons who were called on to make sure that at the end of this particular period, we were able to come through this pandemic in a way in which we can open up the economy, save lives, and do what is necessary. So this will soon be made more apparent, and I would make announcements later down as it relates to when we get this unfold and get this situated properly.
Understood. As it pertains to staffing across the BVI Health Services Authority, you recently made a plea saying that our students must come back home. What is the state of staffing at the BVI Health Services Authority? As Honorable Minister responsible, would you say that we're facing somewhat of a staffing crisis? And what are we doing, if we are, to get those students and to really, really heighten the Health Services Authority, very much so at this very pivotal point?
Well, we are concerned, not unlike most areas in the region or throughout the world, whether it's Canada, United States, UK, because we have seen where even in St. Vincent, if you listen to the regional news, where they were almost exporting health services persons, but at this time they say, well, look, we are going to have to bond our particular students now because we need them here because of this COVID-19. The BVI is not unlike any other place in the world. We have a shortage of registered nurses. We have a shortage of doctors. We have a shortage of different areas. The Cuban Brigade has fit in perfectly. It was a miracle that we were able to have the foresight to bring them in early so that they can fill in the gap until such time as we get the permanent places filled, because we have an issue in terms of making sure that all our people that are out there, not only the students, but those persons who are from the BVI, those persons who want an opportunity. Because I have, from time to time, people calling and saying, well, look, I have studied in nursing, I've studied in this area, dentistry, for instance. Is there a position for me? The answer is, I would say yes, but there is a bureaucratic process that you have to go through, and sometimes the positions are not filled as quickly as you would like. And this is creating an issue, and we have to find a way, because you have to treat the particular occasion with the urgency that it deserves. We must be able to make the best personnel available to the health services. We must be able to get a particular field of doctors or an affiliated institution, so that if we have advanced treatment, we're able to do this. And let me put a plug in here for early prevention. Let us put a plug in here for the fact that we have to do a complete health improvement programs, or any improvement programs to our health, because preventative measures are what we should be moving towards. Dr. Scatliff will be the first to tell you that the community programs, to make sure that all of our eating habits, all of our exercise habits, all of our habits that would cause diabetes and hypertension, and all of these other measures, preventative measures, we must be able to get the community programs back into public health. We must be able to avoid all of these cases. There are too many dialysis patients, for instance, whether it is growing in Virgin Gorda, whether it's growing in any of our sister islands on the main island of Tortola. If you were to check the number of dialysis patients, it is appalling. And we must be able to find ways in which we can lessen the occurrence or heighten the preventative measures that would not have this continue in the way in which it is growing.
Of course, Honorable Minister, CHIP is still ongoing, and persons are encouraged to support and be a part of that program. CHIP is a program really designed through the Ministry of Health to really curb non-communicable diseases, such of many of which you just mentioned. Minister, school is going to be reopening. Our students are going back to school. You're not the Minister for Education, so you can't speak on that. However, from a health perspective, we've heard of the rapid testing, but are you in any way concerned? Do you think that our system is prepared to now receive our students back to school from a health perspective?
Well, the Ministry of Health has been working hand in glove with the Ministry of Education and making sure that all of the protocols necessary for safe return to face-to-face, for in-class schooling attains. We are well aware of the challenges that distance learning creates. We are well aware of the challenges that parents are facing, students are facing. So the sooner that we can return students to the classroom, it is best for all involved. Now, we have the particular health standards that we must maintain. I know there are cry out in other lands for mandatory student vaccinations. I know that even in the higher heights of the particular ministry or in the education department, there is a look as to whether or not this must be mandated. But the government have been steadfast in its resolve not to have mandatory vaccinations. I'm not sure if there are any open debate on that as it relates to the education system, but we would like to make sure that teachers are vaccinated, students are vaccinated, and all of the preventative measures are put in place so that it does not compromise the students, it does not compromise the parents when the students return to their home, and it does not compromise the grandparents who most parents will turn to babysit or to mind their children while they complete their job at the end of the day. So it is a domino effect in terms of the actual benefits that we were afforded going into school, from pre-primary, primary, secondary, and tertiary education. And a generation cannot, you cannot have someone who's now had to undergo the hurricanes Irma and Maria without the normal process of classrooms, and then COVID-19 without the normal process of classroom. So you would have had somebody going from grade 1 to 5, 4 to 5 years, and not see a normal day in the classroom, from Hurricane Irma straight through to COVID-19. So it is a disservice, and of which is not of our making, not the making of any government, but the making of reality, the making of time and of circumstances.
Honorable Minister, I have to ask you as it pertains to, I know we have a vaccine drive. Can you speak to that vaccine drive? When is it going to be taking place, and how can persons who wish to participate get that done?
Well, I'm pleased to again report that through the grace of the United Kingdom government, we were afforded all of the AstraZeneca vaccines that the country can use. In fact, we were afforded now, I think it's now a 3 to 4 week period since we have started the Pfizer vaccines. And this particular move is such that we would like to have, not would like to, we are going to be conducting a drive-through vaccination process on the Festival Village site. It's from 10 o'clock to 6 o'clock, Saturday and Sunday. We will be conducting a vaccine drive-through program. All of the persons from HSA or the staff from HSA, the volunteers from the Red Cross, from the Lions, from Rotary, from other service organizations are asked to come and support this particular program for the registrations. We are asking that you bring our senior gyms out, you bring our kids out, we bring all of those persons, whether it is the first dose, the second dose, or the booster doses, we would have them all available there for you. So we want you to take advantage of this drive-through process. We know that parking is a mess at the Midtown area where we have it at the Catholic Community Center, and the Catholic Church have been most gracious to afford their entire hall to us all during this vaccine program. So we, our hat reaches out to them, all the volunteers that have been in this particular program. But it is critical that we go ahead and we have this particular vaccine program a success. We want to have you to come down. Right now, in terms of third doses, we have about 3,015 persons, which represents only about 10% of our population who have taken advantage of the boosters. So we have 57.5%, 17,236 persons who have been fully vaccinated, and only 3,000 of those have come back for their booster shots. It is critical because we need not wait until the effects of this take hold. We do not have to be encouraged only by hospitalization numbers. We do not have to be encouraged only by deaths. We do not have to be encouraged because of the U.S. Mandate that you cannot come in unless you're fully vaccinated. You can be encouraged by the fact that you either have a strong immune system that will help you fight this virus, or to be assisted through vaccines. Vaccines are nothing new. To get into the school, into the country, into the workplace, to go to certain places in the East, in the West, you have to be vaccinated. It is nothing new. We have different concerns that a number of persons have, and these are sometimes valid. These are sometimes taken. But look at the statistics, and you will then see that it is better that you're vaccinated today. Get your full shot, get your boosters, and I encourage you to come on out this Saturday from 10 to 6 on the Festival Village site, and on Sunday, 10 to 6 on the Festival Village site. You can stay in the comfort of your car, get registered, get boosted, and we welcome you at this time.
Thank you, Honorable Minister. We are out of time, but of course we have so much in store. 2022, of course, being a new year, I am sure that there are some measures as it pertains to strengthening our healthcare system. And I do want to take this opportunity to invite you back to really speak on what 2022 will look like for us as it pertains to holistic changes in strengthening our healthcare system. But of course, for now, thank you so much for your time.
Yes, and I'd like to say thank you very much. And as I told one particular agency before, next time I come, we would have just the stats for COVID, and we will talk about all of the other departments in the Ministry of Health, because we have a full-laden legislative agenda. We have to look in terms of how we make our healthcare system the best possible. We have to look in terms of how we work with the Social Security and NHI programs so that we can strengthen the particular programs and make it sustainable. We have to look in terms of whether it's a Rainbow Children Home or, all of the areas under the ministry, because from life to death, the ministry is actually involved. And there's a number of programs that the population can benefit from. But
Absolutely.
Strengthening your health, making sure that you have safe communities, safe schools, safe working places, safe air condition. In terms of air quality, we must be able to see how this could be done in a safe manner. And the Ministry of Health and all of the staff that has been going through this particular period, we're coming into the 36th month of this administration, and I'm saying it's an amazing group of public officials that I've been afforded the opportunity to work with, and I must take my hat off to each and every one of them, because at the end of the day, it is only by their efforts we can have the accomplishment and go through this particular period in such a way that we can then open our economies, save our lives, save from hospitalizations, and all of the other areas still to be conducted. So
Thank you,
we look
Honorable
forward
Minister.
to coming with you and have a pleasant day.
Beautiful viewers, a lot of content here from the Honorable Minister of Health and Social Development. Of course, that is not all the content we have today. I am speaking with the Honorable Labor Minister himself, the Honorable Vincent Wheatley. That interview will be viewed later this evening. In addition to that, we're covering the state of labor and immigration. We know there have been a lot of burning questions as it pertains to work permit, of course, the rebranding of the system, staff shortages within the Labor and Immigration Department. He's going to clarify all of that for us. In addition to that, the Honorable Minister, 2nd District Representative, the Honorable Melvin Mitch Turnbull, is also going to be in studio, and we're going to share that with you later today. He is clarifying a number of concerns within his district, and namely the partial opening of the King Garden Bay Police Station. In addition to that, my colleague Kamal Haynes and I, of course, will be bringing you the 6 p.m. news, which you don't want to miss. We have quite a bit in store for you, both locally, regionally, and internationally. It is always a pleasure. I'm Ron Grant. Do enjoy the rest of your day. Bye-bye.